Welcome to Pacer Nursing Power Hour, your go to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where students get powered up.
That was good! And we didn't have to look at the line this time.
I
think that's the first
Oh,
time.
top. Yeah, girl. We
Oh.
got it.
Ah,
It's only been like how
coming.
many episodes now? 39,000.
Yeah, a lot. So today, you're in the hot seat.
Yeah.
I get to interview you.
I got to get my nerd on.
Your nerd on.
It was so fun.
This is all about health policy, specifically the South Carolina Nurse Legislature Day that you
Yes.
attended.
So you know how I feel about policy, right?
Yes, this is your jam.
That's my jam.
So much.
So, yeah, this was an amazing day. I went to it last year. So,
Mhm.
go ahead with your question.
Okay, thank you. She's letting me take charge. Whoa.
Shocking.
Okay. Okay. So here are some quick questions for people that have no clue what we're talking about right now. Okay.
Yeah.
So for someone who's never heard of it, what exactly is Nurse Legislative Day?
Well, basically, it is an opportunity for all nurses, South Carolina Nurses Association, to go and use their voice because we don't recognize enough that you don't use your voice. And in school we teach that.
Yeah.
Well, we try to. I feel like, in my
Oh,
opinion,
yeah.
we've got a long way to go. Um, so, and this was a day where they welcomed all nurses.
Hmm.
The South Carolina Nurses Association, that executive board, um, really do an outstanding job.
Is that who organizes it?
Hmm.
Okay, cool.
Yeah,
And it's at the State House, right?
it
State
literally is at
House.
the Capitol
So cool.
in Columbia. Yeah.
Love
It's
it.
amazing. It was awesome. It always is.
So why do you think nurses should care about legislation in the first place?
Okay, well, let's just say, let's talk about what's in legislation right
Okay.
now, which
Okay,
has
yeah, it's
been.
great.
So
Because that was my next question. I think you read my question.
okay, no. Well, it's important because two things. So, these were carryovers from the previous year. So
Mhm.
I ended up at Legislator Day, I can't say the word today, because it was an assignment for one of my classes that I'm in.
Mhm.
And I'm like, what in the world? Like, we were told to wear our scrubs or wear, at least your
Look the
white
part.
jacket. I'm like, what? I'm not going to wear that going to, I want to
Nuh-uh.
I'm just professional. But, anyway, it was for school. We were getting credit for it. So me and Courtney Pinnell from Union, she's in the class with me. We met. And we're like, oh my God. Like, I even tried to back out of it at 5:30 in the morning. Like, I'm like, Pinnell, I really don't want to
I don't
go.
wanna do this.
She's like, get in the car, Kennedy. So I did. And we got there. And, it kind of illuminated. Like, I had no idea what we were doing. I had no idea.
Mhm.
We go into literally one of you have the Capitol where they hold their sessions,
Mhm.
Congress, but then you have the buildings where one's congressman and one's the House of the Senate.
Yep.
So we're in the House of the Congressman in the bottom in a huge conference room. And they bring in breakfast from Lizard Thicket. Oh my god.
Nice.
Now, granted, you have to pay $15, but
It's
$15, that's
good.
it. It is amazing, like, the grits and the egg. Anyway, so I'm sitting there and, we're seeing all these nurses and, yeah, you and I both graduated from, Carolina and Columbia, and I see Doctor one of the, most renowned, I think professors at USC is Dr. Stephanie Burgess,
Mhm.
which I think she taught me foundations, I think.
Okay.
But then I heard she moved into the NP school. Did you have her at all?
I think I did.
Yeah, she is amazing. So she gets up to speak, and we had been given these cheat sheets about what we're here to do. And so basically, there were two key pieces of legislation that was introduced into committees last. So, first you gotta back up and go and remember what makes a bill. Do you remember that Schoolhouse Rock?
No.
Oh my god, okay. So, you gotta understand the process. You gotta understand how a bill becomes a bill and how it has to be introduced and supported by someone from Congress, and then it's gotta go through
The
committee,
whole process.
subcommittees, and then move to the other house, committee, subcommittees, back to and then eventually it's gotta get voted on. So this one of the pieces of legislation was about workplace violence, and
Mm,
that's been a
hot
very
topic.
big dialogue, and then probably I would hope to say globally, but I know for sure nationally.
Mhm.
We've had a lot of increase in workplace violence. Now, is that associated with the lack of mental health? I'm gonna say yeah, but, that's just unresearched, just my biased opinion. And so this legislation, particularly for the state of South Carolina, is gonna make it a felony if you assault a nurse or a healthcare provider,
Mm.
whereas now it's a misdemeanor. You can, I think, I can't remember, it was police officers, firefighters, and then some other area, I wanna say, that is a felony, but not
Interesting, but
healthcare.
not healthcare.
And I'm not gonna lie, I'm part of the problem. I've told you several times over my years in the ER, I've had my nose fractured, a rib fractured, I've been kicked, spit, literally peed on, and then the same person asked me out when he sobered up later that shift. I'm like, "Dude, A, you peed on me, so that's a hard pass, and B, nothing."
Maybe in another
Yeah,
life.
yeah, yeah. No, thank you. No, thank you. Yeah, if you pee on me, that's definitely not a date right
Yeah, that's
there.
a hard no.
And so, they've always said, "Do you wanna press charges?" And in my little nurse mind, I'm like, "No, no, they're
Just
going
do
through
your
it's an
job.
acute phase, they can't help it." Okay, now I have a completely different thought process about that.
Yeah,
If you choose to do bad drugs or drugs then you have a bad
that then leads to something else, yeah. You
that's
still have to
your
be responsible.
choice, yeah.
Mhm.
There's other instances where I'm like, "Okay, but still, if it's purposeful, I feel
Mhm.
like you really gotta stand up for yourself." We've already heard too many nurses have lost their lives, that, mental health unit up I think it was in Pennsylvania. It was an inpatient, pediatric unit, and the patients nursing unit, I think from what I can understand, it was in the middle of they were built around, like, in a circle.
Mhm.
Patients were overthrowing the nursing units, and so the nurses were barricading themselves inside that area. And of course, it's all glass, and so a nurse in the unit within this locked area, being, these people trying to get in and hurt them, called 911. Hospital wouldn't let them in because the 911 responders, the police, showed up with firearms, and they were told you cannot enter the property. I know. So that's really kind of what got my goat. That's just one of 100 stories. Nurse Erica, man, she's the best. She's the one that really kind of lays it out for me. She's
Okay,
a
that's our next mission. Interview her.
Yeah. Oh, absolutely. I
Next
I
mission, Nurse
want her.
Erica, be ready
So
for us.
workplace violence was that. So we really have got to make it a law. And then the other piece of legislation that was on the table was, and this is relevant for you, is full autonomy for nurse practitioners
Mhm.
in the state of South Carolina. I had no idea that 23 out of our, and it's probably higher at this point, 23 out of our 52 states slash
Mhm.
territories, because we have to include Puerto Rico and there's one more, can't remember. Anyway, um, that you have full autonomy. In other words, you
Mhm.
don't, first of all, this was the day that I learned that some nurse practitioners, depending on where you work, you have to pay
Uh-huh.
a provider to be your overseeing provider.
Uh-huh.
And you like, this is what
Not a couple dollars. It's not, "Hey,
it,
let me buy you coffee."
it's up to $1,000 a
Yeah.
month. So these people and
Probably more in some areas.
yeah, yeah, and,
'Cause you can't practice otherwise.
no, not
At
in
least
South
not in
Carolina.
my state.
And overseeing providers, what do, Katie, for you? Half the
Um,
time, they're not in the
yeah, so my
vicinity.
first job, didn't meet him, like, never saw him, he wasn't working in the same facility that I was, worked in a different town, they just have to be located within the state border, and this is South Carolina, so they just have to be located within the South Carolina state border, um, and they have to be accessible, so, like, you have to be able to call them and them answer. Those are the only, like, rules,
Yeah, and then
you
they
know?
have to review, like, X
They
number.
don't that's not a rule.
That's not a rule. That's not even not a
That's
rule.
not a rule.
Ah,
The
interest
hard rule, like the law says they have to
to
be
be,
in the state
like,
and
on call.
accessible.
Okay. So so basically and a provider can have up to what,
6 in
6?
South Carolina,
So
6.
basically, they're making $72,000 a year just by answering a phone.
Mhm.
That incensed me. And then the um, medical association,
Mhm.
they were fighting it hard, talking
Yeah,
about
rightfully so.
that they can't do, they don't have the school, the training, and you've discussed this many times. Medical school, you learn the
Mhm.
didactic and then you go and do the
Mhm.
clinical. We're doing both at the same
Same time.
time. And so I was getting angry.
Yeah.
I was like, I cannot, we have too many deserts. We've already talked about health disparities in our state, but now they're fighting it. And they
Mhm.
because y'all, first of all, you just now got, well, no, midwives still don't have the ability to bill insurance.
Mhm.
Um, that's still a huge topic. So, midwives are in this arena as well. So, just the statistical information that Dr. Burgess was throwing out there. So, basically, what the purpose of the breakfast is to bring everyone up to speed so that the lawmakers there present for the day, um, you can go and have a conversation with them. You have a dialogue with them and you basically you lobby. It's a day for you to go and use your voice and say, I need to know where you stand on this topic because you're my congressman or
Mhm.
senator. Now, the first year I went, I didn't do that. I was like, I don't know. No, 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 thank you. And so we watched. But I will tell you the most awe inspiring moment for me, which was what made me come back that day last year and go to Dr. C and say, we have got to take our students up there,
Yeah.
was that at a certain point, we went into the Capitol building, and we
Yeah.
sat up in the observation. It's on the 3rd floor.
Okay.
And the lawmakers that were introducing the autonomy piece of legislature, but when they're calling roll, after they call roll, which I didn't even know that happened, it was a cool thing to see. And who of my people for Aiken County they are not there,
Mhm.
I'm like, "Okay, where are you people at?"
Where you at?
So, after some people have the ability, congressmen or senators can, announce, certain things, make announcements or introductions. Well, the two gentlemen that presented that piece of legislature recognized all nurses and he made us stand up, and so now we are 300 people, and if you've ever been in the state house in Columbia, it ain't huge.
Yeah.
It's nothing like Pennsylvania Avenue or, wherever. Yeah, it's Columbia.
Yeah.
And so when you see 300 people either in scrubs and a white jacket or a white jacket, it kinda makes sense.
Makes an impact.
Yeah, and so, he said, "We just like to thank the South Carolina nurses for, doing everything," and literally standing ovation of all of
Wow.
the congressperson for
Oh,
15 minutes. Like, it makes me I
just
get
gets excited.
excited, and they were just so appreciative. They were, like, whistling. I'm like,
Love it.
"Oh my god, you really do
Oh,
appreciate us," you felt like you mattered,
yeah.
because
That's huge because
these
in
are the
nursing,
people
you don't
making
get
law.
that.
So, I immediately came home and said, "This is a day our students need to know," because I really did watch Dr. Burgess, and she is really one of the people, they all, apparently all of the know her and TKP, the, SCNA executive director,
Okay.
know her, they know them. Because they are in there, probably call each other on the phone,
Mhm.
like you did for me when I had no
Yeah.
follow that city council
Yeah.
member, yeah. So, it was amazing. I watched her weave in and out and just, have ears and listen, and I'm like, "Oh my gosh, that's amazing." So I kind of started paying attention, got home, downloaded southcarolina.gov app,
Yeah.
and I watch what's in committee all the time.
Ah, I love it. So, if you, in one word, could describe the energy that you feel on that day, what does it feel like?
I think the presence made it seem loud, and
Got you.
there was you know what I mean?
Mhm.
It
That
was
presence was
it
loud.
was palpable. I mean, you could hear it, and, I didn't know until we had that panel discussion event in
Mhm.
fall of this past year. Dr. Hopla is also another, member of SCNA who's, kinda high up. She actually sits on the board of nursing for South Carolina, teaches at Francis Marion, I believe. Um, she was on the panel and was on the panel, and I didn't know until then that the work for the violence got shot down in subcommittee, like, shot down. Like, I wanna know why, and I wanna see who the
Yeah, like,
voted.
who would vote against that?
Yeah. So, apparently, it was attached,
They were sneaky about it.
they attached something on it where someone said, "Nope, I can't do that, I can't vote for that."
So I think that's interesting because when we spoke to Redonda, this was something that we talked about. There is lingo in healthcare and there's lingo with
Mm,
lawyers' legislation,
mm.
and the lingo doesn't jive.
No. No, no, no.
And so and just the life, like, they live a very different life than what we do, not in, like, oh, how they vacation, but just how they get stuff done.
Yeah.
They're very procedural, and there's all these, like, checks and balances, and it takes forever, and nurses are like, "Let me just figure out the fastest way to get it done."
I know. We're MacGyvers.
Yes,
We
and so
do
it's
workarounds.
hard.
It's mind-blowing, lack of speed or brevity of that things occur, because you gotta introduce it, and then you gotta have quorum, just like we have to have
Yeah.
quorum,
Oh,
and if there's
quorum.
not
That's my least favorite thing.
I
Quorum.
I hate that word
Who
now.
ugh,
I know,
quorum.
so, it was kinda crazy. So, yeah, it was
Yeah.
amazing.
I mean, definitely so many perspectives to think about. So, you mentioned 2 topics that y'all talked about last year.
Yeah.
What are some of the topics that you heard this year being discussed?
Same.
Same thing.
They've reintroduced
You talk about slow.
without went back on the docket. So you can only reintroduce or introduce bills every other year.
All that's coming to my
You
mind is they make decisions at the speed that my husband does. Like, "Sorry, babe. Sorry, babe. I've already, like, bought the plane tickets, packed the suitcases,
oh,
have the itinerary before you even have decided where we wanna go."
that's Jeff. I had to put the seed about getting a new car in his
Yeah,
head, and it
and
took
then
him
you
a
have to,
month.
like, "Okay, let me think how this is gonna work for him,
Yep.
so let me"
And
yeah,
he goes, "Okay, I'm ready." I'm like, "Okay, here's the
"We
car. It's
already
in
did
my
it."
shopping cart." Yeah.
That's funny. So same topics this year, and we're
But they
still
added one, and one I
added a new
needed to
topic.
research on.
Okay, so tell me about that one.
It's surgical smoke. And again, I didn't get into
Okay,
the nitty-gritty, but
so we have homework to do.
there's, I guess I'm assuming from the bovie that
Sure.
infiltrates it, and it's increasing an uptick in cancer, or I don't know.
Interesting.
Yeah, so I need to get,
That'll probably get passed
but I
tomorrow,
didn't
but
know this.
workplace violence.
The new thing that I learned this year, though, is that South Carolina Nurses Association actually puts together packets of, like, hot topics and why we need your support.
Can you access those online?
No.
Only in person.
Yeah, I wish I could have. We helped deliver them.
Mhm.
So, here we all are, students, and our community instructor, Professor Britton, allowed all, like, between the 3 campuses, I think we had about 60 students
No way.
and red scrubs
Ooh,
and white jackets, and those red scrubs stood
they
out.
were loud.
And so I walked Dr. C and I were a little bit late getting there, so we walked in. It was my fault, not hers. And our students are in the front on the floor listening, like,
Love it.
like, present,
Uh-huh.
because you can't not be present.
Yeah,
It
it
is
just sucks you in.
it just like and then I saw Dr. Hopple again, and I fangirled out again, and she gave me a big hug. I'm like, "Oh
We're
my god!
besties.
Oh my god!" And, it was just amazing. It was just amazing.
So you as a nursing instructor and seasoned nurse, what role do you play? What role have you played the last 2 years on this day?
Uh, the first year was observer. This year, I got in it.
You were in it, so you were talking to
I
legislatures.
and our
Legislators.
I actually got our students involved in delivering the packets.
Okay, so students were handing out the information to nurses or legislators. So they
Legislators.
actually had to, like, be like, "Hey, excuse me, sir."
Yes.
Do you know if any of them actually had a conversation
Yes, I
outside
did.
of?
We did. Oh, yeah. A whole group
Okay,
talked to Aiken County
okay,
because some of the offices, there's 4 legislators in, like, a suite, so to
okay.
speak. They each have their own office, but there's so we
They're
walk
like,
in.
"Oh, hey, Bill."
Yeah, exactly.
Okay.
So we walk in and, while we don't see the legislators that are particularly from our specific,
Mhm.
we see other Aiken areas or
Gotcha.
proximity, and literally sat in there and I literally said, "I need to know where you stand on these bills. Tell me what your thinking right now is and why."
So in those packets that you had, was the breakdown of the bills in there or?
Honestly, they were sealed. We couldn't. I
Okay.
regret not
Oh,
being able to
these are like
look.
confidential
Yeah.
packets.
I mean, I'm
Okay,
sure they're
special packets. Gotcha.
not, but,
They're not like high confidential.
I didn't wanna go up to,
You're like, "Hey, can I have that?"
"Yeah, can I have a
Kinda
packet?
like my Nana
Can I?"
taking home, like, all my dance recital
Yeah,
little, like, pamphlets.
yeah, but,
Ah,
it was when I heard because Dr. C and I went and talked to because we have a legislator that really is very supportive of our
mhm.
school, and so we were gonna go find him, and we walked into the office, and he wasn't there, but we heard the legislators that were there had just said, "Oh, yeah, we just spoke to 2 groups of your students before you
Good.
got here." I'm like, "Oh my god." I looked at Dr. C, I'm like, "Yes."
Yeah.
So they understand, and I think the point of it all is that, we know what's the right thing to do. We sit
Mhm,
here, we vent back and forth,
mhm,
but unless you go and help make that change happen,
mhm.
this is the day to do it.
Sure.
It's not gonna get done. You gotta use your voice, no matter where you go, and I think that's why you know me.
Mhm. You have a voice. You're good at voicing.
Well, yeah, it's either that or I'm irritating because I say stuff that shouldn't, but I like to think that I'm doing it for the right
You do.
reasons,
You have a good heart.
and I'm not gonna stop.
Mhm.
Like, holy cow.
So for someone who's going for the first time,
Mhm.
AKA me next year,
Yes.
what homework should you prepare ahead of time before you go?
Okay, so this was good because I did this.
Okay.
Um, because I the class that I had to go to the previous year, I knew someone in that class this year, so I'm like, "Tell me what they're
What
saying
are the
for
hot
y'all,"
topics? Yeah.
and she sent me everything, and there really wasn't anything like it was last year, and so I'm like, "Okay, well, I need to get on board." So I went into you can go into the register and southcarolina.gov, and
Mhm.
you can start searching, like, topics and where, finding them, who introduced them,
Ooh, you get all the tea. Okay.
where they stand. It has like, that's why I'm looking at committee meetings when they after they, finish and they post the minutes, so to
Mhm.
speak. And I like to see if they voted or is it still at a standstill. And so I actually created a snippet and posted it into our Blackboard for the students. I'm like, go and do this before you go.
Sure.
because that's gonna, get you on board to where
You're
this
not
is in
going in
committee.
blind.
Yeah, and so workplace violence,
Mhm.
it was reintroduced in January after it was killed in subcommittee, and not literally killed, it's a
Mm-mm.
metaphorical kill, um, because 'cause we're talking about violence, um, but it got reintroduced, and that was a new thing I didn't know either. It's every other year.
Every other year, what? You
You
can
can
introduce something?
introduce a bill. It takes that long for stuff to go through. Well, there's a nurse somewhere on one of the, like, from Charleston, because she's, sits on there's actually a subcommittee for healthcare disparity for children,
Okay.
and I've been following that subcommittee. Like, what's going on? Why is it a subcommittee?
Mhm.
What's happening that it needs to be a subcommittee? And it was the disparity conversation. And what I have found often, though, is a lot of these meetings get canceled,
Hmm.
and I'm not sure what's happening, and I want to know why.
Hmm, interesting.
Yeah. So,
Next year, we're gonna
but
find out.
again, if we go up and show up, it's going to keep you. It instills your faith in your profession.
Yeah.
Like, we struggle with that
Yeah.
because we kind of know what the state of the workforce is right now.
Yeah.
Um, but when I go there and I'm with my people and we are fighting for what we need
Mhm.
to do to be able to do our job better,
Mhm.
I'm like, heck yeah, let's throw down. I'm ready. Not where I'm wearing sneakers this year.
I'm wearing sneakers. Let's go.
It was pouring raining this year too.
Mm.
It was awful.
So, for someone who's never done this, how nerve-wracking is it talking to these
Oh, it's very.
policymakers?
It's very. That's why I
Do they
didn't
ever
do it the first
challenge
year.
you? Do they ever, like, challenge you back if you say, "Hey, these are my thoughts, this is what I'm thinking," or if you ask a
Oh,
question, do they challenge you?
oh yeah, they're going to.
Okay, so tell me more about
Because if
that.
they have an opposite stance, so like if you know this a physician who's in that
Mhm.
position or is
Mhm.
a avid medical supporter,
Sure.
he's gonna come right back at you, and it's gonna end up in a debate, a professionally
Yeah.
toned debate, but it could be.
Hmm.
Absolutely, and
Hmm.
why wouldn't you wanna and they're people too.
Yeah.
Like, I literally was blown away, and I've known some politicians, like, my parents were friends with, like, city council, the mayor,
Yeah.
and they never wanted to sit by me at dinner because those people knew I was like, "Hey, we need to have a con." Like, I was even then, I didn't know I was doing it, but I was doing it. Um, so, I I never really thought of it, but when I got to State House, I was intimidated beyond, and I'm probably older than half of them there.
Yeah. Yeah.
Um, but this year, I just said, "We're
You're
doing
like, "When
it,"
is this happening?"
and the students were doing it. Like, I was too shy to eat and me, shy, the first year, and these
And then these
guys are
students still write in.
rocking. I
So
was so proud. I
oh,
don't like
yeah,
to
you're
use
like
that
a
word.
proud mama.
Yeah,
Yeah,
yeah.
I feel that. Have you ever had an experience throughout these days that made you change the way you view a certain topic or nursing or anything?
Um, I mean, w I think if anything over the years, all the things that I've done only reinforces why why I have to do like, you've gotta document, don't just check a box. I always tell this story, we've talked about you and I have both been SANE nurses, sexual
Mhm.
assault nurse examiners, um, and I've been in court twice as a, witness. Not a fun
Mm-mm,
not
very
fun.
intimidating.
I highly encourage you to stay away from it.
And
Um,
I'm like, "Go for it."
yeah, because and then I had a law enforcement person hand me a Q-tip and
Mhm.
said, I want a swab from here for this patient." I'm like, Is this for evidence?"
Right. That's a little sketchy as
And
sketchy.
he said, "Yeah." I'm like, "Well, I'm gonna do the whole thing."
Mhm.
And they don't like that because it
Mm-mm.
takes hours.
Yeah, at least 4 hours. Yep.
So, if anything, it just kinda it strengthens my commitment and keeping my values when it comes to stuff
Mhm.
like that.
Yeah.
And yeah, I'm guilty. We talked all through the whole redundant. Like, there's not one person I don't know that has done everything she did.
Right.
I mean, honestly, I envisioned it during it.
Mhm.
I just ran into an old friend of mine that I used to work with in the ER years and years ago. We were
Mhm.
still husband number one, like.
It's been a minute.
And, I saw her and she's like, "Well, what are you doing?" And so I told her about Redonda. And she's like, "Oh my God, I remember that." She's like,
Yeah.
"I remember thinking, holy crap, yeah, I did that too." And I'm like, yeah,
Been there.
I know. So, it just kind of reestablishes my compass, so to speak.
Sure.
And then knowing that they don't take it lightly. At least I didn't run into anybody, any legislator that took it lightly.
Mhm.
They were impassioned with us.
That's good.
Yeah. It was such a great experience.
So a lot of our viewers are students.
Yeah,
They're not in the workforce yet. Why should a student care?
because this is where you're going.
Yeah.
I mean, if you get punched and
Yeah.
you need to it needs to be a felony.
Yeah. Yeah, I think it's hard to look that far into the future, but if you can mold something to be exactly how you want it before you even get there, wouldn't that be like a
But
beautiful thing?
let's think about this right now.
Okay, let's think.
She's a felon.
Mhm.
She got charged with negligent homicide
Mhm.
with just a medication.
Mhm.
A patient beats a nurse to death, and it's a misdemeanor.
Mhm.
Someone still lost their life,
Right.
and that person
That's crazy.
that it's just a misdemeanor because it's not a felony assaulting a nurse. Um, they can carry a firearm at some point.
That is,
They
I've
can
never
vote.
and I don't know all the ins and outs, like, you know so much more than I do. I'm very negligent when I, like,
But
with the
look
knowledge
at the
related to this stuff,
reality
but
of that.
yeah, no, when you say stuff you're like that, you're like, "What the world?"
That's just wrong.
Mhm.
If that poor nurse in Florida that lost her both sight, she lost one eye and then ended up she lost her sight. Lucky that she scathed away with her life. Um, and he walked away. He probably whatever's happening right now. It's not a felony.
Ugh.
But then you have Redonda,
Mhm.
who
Which she would totally correct us and say, like,
it wasn't about her. Yeah,
yeah.
stop. Yeah,
But yeah, we're just, like, comparing
the
apples to apples, but they turned out apples to oranges.
the consequence of the action.
Mhm.
It's insanity.
Well, because this is your jam and you know so much about it, what are some things that nurses deal with every day that have been influenced by policy?
Uh, literally, policies. Policies are made because stuff happens. When
Mhm.
sentinel events are those like the death of Miss Murphy,
Yeah.
a bad outcome. Um, that's why one facility started labeling all of their lines
Yeah.
with pre-made labels, not
Mhm.
just clear tape and a Sharpie.
Yeah.
And it very discernible. And we did rounds and checked line labels, and you got
Yeah.
written up. There were consequences. So if you don't realize it when you're at the bedside,
Yeah, because it's so like, we're
you're
so
so far removed.
microscopic at that
Yeah,
point, like, you gotta kinda step back.
yeah.
Yeah.
And I think that's why it's so important for whoever your management is. They need to be in in reality with practice.
I thought of another interview question.
What?
You should ask your management, "Do you attend legislative day?" Are you
Mm.
gonna speak up for me?
Oh, that's a good
That's
question.
a good
That's good. Because
question.
I always tell students when they're interviewing for a job, just don't let them interview you.
Yeah.
Walk out, say, "Hey, can I take a tour of the unit?"
Mhm,
And observe that unit.
mhm.
Observe those team members. Are they helping each other out?
Yeah.
Is someone answering that person's call light or taking care of that pump that's not
Mhm.
theirs that's going off? You know,
That
interview.
speaks volumes.
That's a
Yeah.
great conversation.
I like myself sometimes.
And so many days right now, there used to be the whole magnet thing was in vogue, and I
Mhm.
don't know if people know what magnet status
Yeah,
is.
magnet status.
So it's, through what, ANCC,
Uh,
American Nurses is
yeah, that
it's a yeah,
sounds right. I don't
it's
know.
a
I can't confirm or
certificate.
deny.
It's kinda
This is
like
your
joint
thing.
commission, but it basically it establishes your hospital as a hospital of excellence
Mhm.
for nursing from
Yes.
the nursing perspective. So they have what's called shared governance, which means everything that's governed and decided upon, a nurse is seated at the table.
Interesting.
Um, and when it comes to nursing things, they actually have a greater voting right.
Interesting. I didn't know that. I knew things like for a magnet status hospital, you can't have an ADN. Like you would have to have at least a BSN
They
or
have
higher.
80%. Yeah, there's certain
Yeah, there's
credentialing,
like
but
certain criteria to
the
meet that status.
biggest thing
But
is
I didn't know that. That's
that
interesting.
it's nursing centric because
Interesting.
we are the ones taking care of.
They're the ones with the hands on the
Yeah.
patient.
And I'll tell you, one of the best hospitals I've ever visited that had like a true shared governance was MUSC in Charleston.
Still that way?
I don't know.
I would be curious if those
The pandemic
hospitals.
just kinda threw it all
Oh
out the
yeah.
window because at that point, everyone was trying to get magnet because it was
Mhm.
ideal,
Mhm.
bragging kinda thing. You didn't get any more financial reimbursement from federal or state government. It's just bragging. And it's nurses wanna if I chose, I wanna work at a hospital that's I know will fully support me, and that's what a magnet status hospital will do. Um, I forgot where I was going with this
I don't know.
conversation.
I don't know.
Oh, well.
I would be curious to know if those hospitals have lower rates of bad things,
They
bad
do.
outcomes.
That's the whole thing, it's all evidence-based. Yeah,
I'm just curious if it truly does,
and
if it truly is like a significant difference.
I wanna say pre-pandemic, there is
I'm
evidence.
gonna go fact check this.
Post-pandemic, I think magnet status for any hospital that was I mean, there was a positioned C-suite person
That ran
that
that.
was preparing magnet status.
Mhm.
Um, Post-pandemic, everyone kind of abandoned that because, you know, one of the major things is 80% of your nursing workforce had to
Mhm.
be baccalaureate
And
prepared,
during the
and right
pandemic.
now, we can't keep enough.
Yeah, exact.
So, it's kind of fallen by the wayside. I would like and again, that's up to us to bring it back.
Yeah.
It's up to us, and it's up to us to start using our voice and speak up and say, "Yes, I wanna press charges," or, "No, I'm
Yeah.
not doing that. I don't have a scanner. I'm not giving that
Mhm.
medication down here,"
Mhm.
Those kinda things.
So, first things that come to your mind.
'Kay?
What's the biggest myth about nurse advocacy?
That no one listens.
I like it. What's the most surprising thing you've learned through this experience?
They y People actually listen.
They actually
They
listen.
do.
You
The
speak and they
legislators
listen.
do. Like, if you
Yeah.
take the time to drive into
Mhm.
it was amazing. I cannot even tell you how cool it is.
Um,
But I'm a nerd too, though, when it comes to this.
the next question I had was, would you go again? And I know it's yes.
Oh my gosh, yeah.
Did you fuel with caffeine that day?
No, I didn't need it.
Oh,
I
your
was
energy
I
alone
was
got it
cracked out on
going.
life, man, right there.
Oh my gosh, I love it. If you could say one thing to every student nurse or new nurse listening right now about advocacy, what would it be?
Advocacy is just not for the patient anymore. It's also for yourself. We drill in patient advocacy. Yes, that's our number one job. But you also have to advocate for yourself
Right.
so that you can do what you need to do. So it's got to be for yourself too. It's not just about the patient, it's about you.
Mhm.
Because environments are bad. We talk about burnout, stress, um, all of the things that lead to stress. And a lot of that is workforce environments, not
Yeah.
having a stable environment. And everywhere you go, you'll see beds closed right now.
Mhm. Yeah.
It's crazy. It's When I graduated from nursing school, we were in a almost like a state we are now, not super shortage, but we knew back then about this shortage that's
You've
about to
said that
happen.
before,
We
yeah.
knew when the boomers would retire, which is what's beginning to happen, that we were going to be a third of our almost, I want to say a third of our workforce was going to retire.
Mhm.
And we didn't have the capability back then before the pandemic to,
To catch up.
yeah, to fix it or correct it ahead of time. Pandemic just
Made it
threw that
worse.
sucker just into hyperdrive. So we gotta make it better. So we wanna stay, and we wanna
Yeah.
do like, that friend that I ran into today, we both said, "There's no way I could go back to bedside right now.
Yeah.
I know too much." I get I But then again, I'm thinking to myself,
You're the kind of person that
"Yeah, you
needs to
need
speak
to
up.
get your butt back at the
Yeah.
bedside," you know?
Yeah.
Um, but I feel like that's where my voice here matters.
It
I
should.
think
It should.
I you know, I feel like the student who didn't argue with me,
Mhm.
and I love that she didn't, but she was back and forth about a test question,
Mhm.
and she kept bringing me her perspective. I'm like, and she was worried I was gonna get mad. I'm like, "No,
No.
I want you to ask these
And
questions."
if I as a professor truly end up being right, sometimes I do make mistakes,
Yeah,
valid, but this is a whole learning thing. This is how you learn.
she's
Yeah.
never gonna forget milkshakes.
Oh.
Yeah.
Dee, 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 dee,
I know.
dee, 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 dee.
No, milkshake brings out boys too. But yeah, so I'm like,
Well,
that's the first step right there, and,
yeah,
and not,
having the confidence.
yeah, and then saying,
Mhm.
hey, can we just have a
Yeah,
conversation, not confrontational,
yeah. Let's
but
just
just
chat.
conversation. Like, this is what I'm thinking,
Yeah,
you know, and I'm like, do it,
I love it.
yeah. So
Well,
don't be confrontational or debate
I'll
about
be
every
brave.
single freaking thing, but use your voice when it needs to be heard.
Mhm. Well, I am grateful for you. I'm thankful for you that you went to
You're
Columbia,
coming next
and
year.
I
I
am,
cannot
I
wait.
am. That you spoke up for nurses in general and specifically nurse practitioners like me. So I appreciate you. Thank you.
I hope you
I
get
look forward to it
we
next year.
we gotta contact your legislator. If you don't know who they are, send me an
Yes.
email. I will tell you who it is and
Yes.
give you their address. I know where to find it.
Yep. So, as always, thank you for listening. Thanks for watching. You can catch us on Spotify, Apple Podcasts, and YouTube every Wednesday. And always follow us on social media.
And
And thanks
thanks
for
for
scrubbing
scrubbing
in.
in.